Hey guys, Dr. Stephen Greenberg here. We come here every day talking about cosmetic surgery or injections or non-invasive treatments or whatever you want to talk about. Just ask me whatever questions you want. Either just direct message me or email me. GreenbergCosmeticSurgery.com is the way to do it. Tons of questions came in today. And by the way, catch my Instagram live every day, 11:30 in the morning and 8:30 at night. So I'll be going there right after this in just a few minutes from now. A lot of people asked me questions today about facelifts, so I just want to cover it really fast. When we're talking about facelifts, first of all, I like a really natural look. I hate when things look fake, so you have to be amazing and natural. But these aren't as big a deal as you would think. You know, gone are the days where everyone's like pulled back so super tight. That we don't do. So we like a really natural result. I make a small incision around the ear and just gently pull back. And that helps the neck as well. I do a lot of what we call mini facelifts, or now I have a newest thing called a micro mini facelift, which we'll talk about in just a few minutes. But let's just talk about facelifts for a second. Gone are the days, as I said, where you look too tight and too pulled and unnatural, because I will never do that to somebody. But when we make this incision, it allows me to do two things. It allows me to go underneath the skin and pull back the skin. But there's also a deeper muscular layer underneath the skin, which we're pulling back as well. So if you have a little jowl, if you have a deeper fold here, if you have a cheek that's kind of falling down, or if you have a neck with a lot of stuff, extra skin and fat, we can easily get rid of that. With a mini facelift, I concentrate mostly on this area and a little bit on the neck. So we pull up and clean up the neck, and it's a quick and simple recovery. Patients with a mini facelift go back to normal activities in 4 or 5 days, and that's it. And I've gotten patients back with a mini facelift after just 24 hours, if you can imagine. So it's really simple. My newest micro mini facelift, which I started to do this about a year ago, I make just a little tiny incision here, and that's for someone with just a little bit of a jowl, a little bit of pull in the neck. I make that incision, we go underneath and just gently pull up with a couple of stitches underneath, and sometimes I'll do that along with a thread lift or a fat injection or something else, but it doesn't have to be a big deal. Truly, it's a 24-hour recovery. I mean, it is nothing. You can put a little makeup on, and in 24 hours, you can be back and looking really, really good. So there's a lot of different possibilities out there for different types of facelifts. It doesn't have to be the old Joan Rivers, if you guys remember her, where she was pulled too tight, or the Catwoman, or anything like that. It doesn't have to be like that anymore. You have a little gel, you have a little extra skin underneath the neck, you want to do a little tiny incision here, I pull it back, and I have you out to dinner in a very short period of time, 24, 48, 72 hours, something like that. So there's not a lot of downtime. There's not a lot of bruising. There's not a lot of swelling. There are things that we can do to make you look better very, very quickly. It's not what you think. These procedures are done in the office ambulatory center, and you go home right away after. So you're not having so much downtime as you may think. And thank you, Dina. And patients are really back to normal activities so amazingly fast. Now, often I'll combine a little lift with some fat injections or other types of injections, some Botox or something else. And what does that mean? That means if we're doing fat injections, I'll put some fat in here and put some fat up here or whatever, wherever someone needs it, to give a little extra volume. Because we lose volume as we're getting older. That's the whole key to aging. There's two things that are going on. The fat is descending. It's coming down in the face, causing the jowl, causing the extra skin on the neck, and you're losing the volume that you had once above in the high part of the neck and the face, and now it's coming down. Thank you, Justina, who is going to come and see me. You're losing the upper part of your face fullness like kids have or younger people have, and you're getting very, very full in the bottom part of your face. And that's really the sense of aging. The other thing that happens is you lose elastin, you lose collagen. So what happens is you tend to get thinner skin as we age. You tend to get skin that doesn't look quite as plump and as thick and as rich and as elastic as a younger person. So that's what happens with the aging process. It's a gravity thing, it's a hormonal thing, it's as we age, everything thins out. All aspects of the skin thins out. So there's a lot we can do. Now, if you want to look at non-invasive options, I have a gazillion of those as well. Whether it's a combination of different injectables, Restylane, Juvederm, all the injectables that I do every day, or in combination with some laser treatments to help tighten the skin. Ultherapy is a nice one. Ultrasound-based technology helps to tighten the neck, helps to tighten the jowls. So that's not a bad technology. And we have other skin tightening lasers as well in the office. And we're going to be talking about a lot of these different skin tightening modalities on Instagram Live on my page, Dr. Stephen T. Greenberg, at 8:30 tonight with one of my estheticians. So there are things that we can do non-invasively or minimally invasive. The thing to do is you have to see me for a consultation. So that's the cornerstone of this. And by the way, I'm seeing virtual consultations, a lot of them, all day long, every day, 7 days a week. We're seeing virtual consultations so I can see what you look like. And I'll make my recommendations. We'll put you on the right program. We'll get the right either non-surgical or surgical procedure to do. And we kind of figure out what's best for you. We'll do a little computer imaging. I don't know if you saw today on Instagram Live at 11:30 a.m. edition, I was doing Vizia skincare analysis to show people what they could look like with their skin. So when you're looking at facial aging, or any aging, you're looking at two different things. You're looking at the anatomy. What's happened? You're droopy, you have extra skin, you have extra fat, and you're looking at the skin quality, the pores, the red marks, the brown marks, the fine lines and wrinkles. That's different than looking at how you're sagging. And we have to address both of those things when we address facial aging. You want to have a comprehensive approach. You want to have an anatomical approach? Okay, that's pulling it back up. That's using little threads. That's using Ultherapy, little mini lift or whatever it is. And we have to look at the skin quality. Skin ages, everyone the same. Pores change, oily or dry skin changes, fine lines and wrinkles, brown spots, red spots, all blotchy skin, melasma, things like that happen as we age. So we have to address that with different modalities. Lasers help, IPL, intense pulse light lasers, all sorts of resurfacing, microneedling, and PRP. There's a gazillion things that we could do to help the skin look better. So you have to address those two issues. Skin care, with lasers or hydrofacials or whatever we're going to do, along with the other problems that we have. So Dina's asking, how can we address the crepeiness under the eyes in a least invasive way? Two ways to do this. Number one, there is a laser that's called a CO2 laser. That's like a sandblaster, okay? You're going to resurface that. It's going to look great. There is some downtime with that. There's about 5 or 6 days of peeling and redness and all that. But there are other ways that we can do it that are not as invasive. There is a laser that we use. It's called a non-ablative laser. So it doesn't destroy the outer epidermal layers of the skin. What it does is it resurfaces over time. So typically when we use a non-ablative laser, as opposed to the CO2 laser, which is ablative as we call it, it wipes out the epidermis, the non-ablative lasers take a bunch of times, but can help with the crepeiness under the eyes and the fine lines as well. So that's a really nice way to do it. Sometimes, I don't know if you guys saw yesterday on Instagram Live, I did a peel on Gail's face on the 11:30 a.m. edition of Instagram Live. If you go to, it's the Dr. Stephen T. Greenberg site. You can see me doing a peel, and I peeled underneath her eyes a little bit as well. That helps with the crepeiness as well. So there are things that we can do that are minimally invasive, that can really get you back to normal activities really super fast. I am going to hop over to Instagram Live, Dr. Stephen T. Greenberg's site. I start there at 8:30. We're going to have a guest on tonight, so stay tuned. Flip over to Instagram Live, Dr. Stephen T. Greenberg's site. If you want to see me for a virtual consultation, I'm seeing them all day long. Go to greenbergcosmeticsurgery.com or instant message me, and we will hook you up. A lot of people are asking me questions about when is their surgery, when can I have the surgery. They want to travel in to see me. And basically, we pushed off surgery about 3-4 weeks from now. We're going to get you on. when we're working nights and weekends and whatever we have to do to get the procedures done. So don't worry, I will fit you on my schedule. Thank you so much, Jess. I appreciate that. I look forward to seeing you guys. Go to Dr. Stephen T. Greenberg's site. I start at 8:30 sharp. I'll see you there in just a few minutes. This is Dr. Greenberg. Have a great night, everyone.